What we don't make here are teeth. What we make here are prosthetics, and prosthetics are pieces of engineering that are there as replacement so-called teeth, but are nothing to do with teeth at all. So the materials that we use are PMMA blocks, as you can see from this. These are discs. These are already pre-made, and we also use titanium. So they're solid. They're not powders, or, we're not sitting around casting stuff or making it in a pottery shed. These are designed to be milled on medical grade milling machines that work to very high tolerances of accuracy. And what they produce is the following. So from the titanium disc, we produce a titanium bar. And from the PMMA disc, we produce what we call the veneer. The two parts are designed to fit perfectly together, like this. So as you can see, the two parts are custom made for every individual person, and they are bonded together, and each one has a different function. The veneer itself is designed with several things in mind. One of them is it's incredibly light, but it's also more than strong enough to do normal chewing. So you should be able to bite an apple, you should be able to eat a steak. What it can't do is crack beer bottles open with your teeth, or chew ice cubes, or eat solid pieces of chocolate straight out of the freezer, because you shouldn't be doing that with your own teeth anyway. And unlike natural teeth, which, as we've discussed in other videos, sit in an elastic pocket called the periodontal ligament, which acts as the shock absorber, implants have no shock absorbers. So in all engineering, we have to reproduce the shock absorber, and we reproduce that with this material, which is the PMMA, which is exactly why we do not and will not use zirconia or ceramics or any of these hard stroke brittle materials, because they don't act as the fail-safes we want. Because what we don't want to happen is we don't want any damage to the implants in the jawbone, because that will require surgery. Whereas if you break a prosthetic, and that is the reality, people will break prosthetics, we just can't predict when, but it's usually when they're not thinking. It's actually very easy to just replace this part, because it's virtually unheard of that anyone manages to break the actual titanium bar, because it's a solid piece of metal, okay? And once the two bits go together and they act as one, they sit with comfort. And also we can see the internal dimensions of it, and we can see we have screw holes, and it is through these screw holes that we tighten everything to the actual implants themselves. So we use titanium and PMMA. Okay, we don't use any other materials. Yes, there are other clinics out there that will talk about ceramics or zirconia being better. Better is really a question of what are the compromises you are prepared to accept. So better aesthetics, not necessarily so, but harder overall material, which could be detrimental to the implant in the long run, in my view, isn't a compromise that I'm prepared to accept for our patients, because what we're interested in is optimal longevity. How long can things last without needing surgical intervention, again, is our idea of success. And how do we actually create these? Well, we actually design them. And then it gets sent off for milling, and then we produce the parts to a very high standard of accuracy, and then we put it all together, and then we do our final quality checks before we deliver it to you. The other major advantage that we have is when people have had a misaligned bite for a very long time, and we need to calibrate chair side, make small adjustments so everything fits just so, it's actually very easy to do it with this material. It's much harder and much more destructive to do it with ceramic-based materials or zirconia-based materials, because once you damage the outer glaze, then you're actually exposing the porous inside of the material. So a classic example is a chipped dinner plate. So a dinner plate has a lovely smooth surface. That's the glaze, the fired glaze. Once it chips, you will notice that the area that's chipped is porous, and that is what's going to absorb oral fluids, which means oral fluids are now going to live inside the prosthesis. This material has very long continuous polymer chains and is non-porous. So we prefer to use this material, and it's also very easy to service, and it's very comfortable. for patients to actually wear, and that's why we use it.